Hi, I'm Dr. Sidharth Sahni. I'm a senior consultant breast surgeon at Multan Medicity in Delhi. And I'm going to talk to you about what an integrated approach or the best practice approach to dealing with breast cancer patients is. We all know now that whether it's surgery or chemotherapy or radiation, the indications for whether you need a breast conservation or a mastectomy, or whether you need chemotherapy, the type of chemotherapy, whether it should go up front or follow surgery, all of that, the types of radiation, all of that is now, for the large part, for the majority of the last decade, been fairly standardized. And I think today in our country, in the major centers of healthcare, whether it is private or government funded, I think we all follow the same pattern, and it's a good standardized system of medical care for patients across the board. What is, however, lacking, and this is what differentiates great breast cancer care as offered in places like Sloan Kettering or London, Paris, Milan, etc., is the overall approach to the patient. Rather than just treat the patient as somebody who has an illness and needs to be given surgery, chemo, radiation, in whichever order, I think we need to start focusing on patients as human beings as a whole, where not just the medical therapy which is needed, but it's also the other treatments which are equally important, such as nutrition, such as physiotherapy, physical therapy, therapy for an explanation about how to manage and deal with lymphedema as and when it occurs, advice, counseling, and it's just generally an integrated part of the treatment process, as it were, or therapy process, as it were, in the West. And this is what we, in majority of the centers, lack as a whole. Whether we can have a part of it in our hospitals, but somehow nobody's really brought it together to fit in with the medical aspect. I remember all my years of training in the UK, when we used to do the breast clinic, there was always a breast care nurse who would then look after the patient on these aspects by integrating them with the nutritionist specifically for who was designed for oncology, with physiotherapists and physical therapists who would tell the patients what exercises to do for which part of the treatment, and people who were always ready for counseling, professional counselors, psychiatrists. Now we know that that's very important, because all women on hormone therapy do have some degree of depression. And despite being told that at the start of the treatment, whenever it has been suggested to them that they should go and see a psychiatrist, it's almost like they feel as condemned as they did when you told them that they had breast cancer. And they're just not ready to accept the fact that a drug has been given to them which has induced a chemical reaction in their brain, which has brought both the dopamine and the serotonin levels down, and that needs to be chemically corrected specifically for the duration of the therapy. I mean, it is hard enough to take the diagnosis of a cancer and all the mental and physical stresses that go with the therapy that follows. So you're already looking at a person who is, by and large, on a mental downer, and then to be given a drug which furthers that is something that's been very challenging. Fortunately, having worked with an organization like CARA for the last 5 years, we have now integrated them here in our breast unit, and we run as much of a joint clinic as we can, so that the patient is not just looked after from a medical point of view, but we look after everything else for the patient as well, including their nutrition, counseling, physical and physiotherapy, yoga, and everything else that doesn't have an immediate medical concern, but in a patient's life can have a massive effect on the quality of life that a woman has during treatment as well as once treatment is done. And I think this integrative approach also leaves touch points open for the patient to connect when they feel that it may not actually be a medical decision that needs to be made, but just something in their quality of life which is lacking. Maybe you're not having the right diet when you're recovering from say radiation therapy, and you just feel beat and low and just lacking energy all the time. But it needs to be brought into the system, because for the simple reason that it offers patients the best chance of getting back onto the merry-go-round of life that they fell off when they were diagnosed with breast cancer. Thank you.